hospice in north of London, and as you can see, I'm standing in a beautiful garden. And this is exactly the kind of place that people who run this hospice and the patients that I've spoken to have said that they would like to be at the end of their life if they can't be in the comfort of their own home, in an environment like this that's very nurturing and peaceful and supportive. But most people are not dying in places like this. In fact, half of all people who die in hospitals in England, half of all people who die in England do die in hospitals. And what this report is saying is that they're really not being consulted. It's not necessarily a question of not receiving the right medical care. It's a question of being included in conversations about their treatment, about the kind of pain relief or artificial hydration and nutrition they'd like, and also, really importantly, for family members and friends of the person at the end of their life, for them to feel emotionally supported. And that's what's not happening at the moment, and what this report says very strongly needs to change. Absolutely. There's really still a taboo in society, end-of-life professionals say, about talking about death. We're interested in other people's deaths, but when it comes to our own, we don't feel comfortable talking about it. It's Dying Matters Week this week, and there's been a survey just showing that the vast majority of people in the UK don't feel comfortable talking about their own death, don't know what the wishes of their partner or loved ones are for the end of their life. So this is partly about making people aware of the fact that dying is something that happens and that can be embraced, and that if you embrace it, it can really change the experience. It doesn't have to be a negative one. It can be a much more positive one if you're in control, if you're consulted. And I think really what comes out of this report is that health professionals, doctors and nurses, just like other people in society, don't feel comfortable having those conversations with patients. In most cases, don't even tell them they are at the end of their life, and that that's something that they need to be trained to do in a dignified and responsible way.